Hi, I'm Dr. Brad Sabatini, and I'm an orthopedic surgeon specializing in foot and ankle surgery in Huntsville, Alabama. Chronic ankle instability is when the ligaments damaged during an ankle sprain are stretched out, weakened, and fail to heal properly. Patients often experience continued pain, swelling, and frequent ankle rolls. They feel like their ankle is going to roll on them or give out, walking on uneven ground, or even just stepping on the smallest of objects. Over time, without treatment, microtrauma from the repetitive instability or repeated ankle sprains can damage the ankle and lead to arthritis. Well, the initial treatment for an ankle sprain is anti-inflammatories as well as RICE treatment, which is rest, ice, compression, and elevation. Sometimes temporary immobilization in a brace or a boot is needed, followed by rehabilitation such as physical therapy or home exercise program. If conservative treatments fail to resolve one's chronic ankle pain or instability, then it may be time to consider surgery. Over the past 2 decades, the gold standard has been the Brostrom procedure. This procedure consists of tightening and reattaching one's ankle ligaments. But unfortunately, patients often have to be immobilized in a cast and non-weight bearing for up to 6 weeks to allow the ligaments to heal. Luckily, there are new treatment options available that will significantly make the recovery process of that procedure easier. Suture tape, such as the Arthrex internal brace, is a non-absorbable Kevlar-like band placed over the top of the ligaments to help augment the repair. It acts like a seat belt for your ankle, stopping it before it rolls too far. It also helps to stabilize your ankle while the ligaments are healing, which allows for earlier motion and weight bearing. It is performed on an outpatient basis through a small incision in just about an hour. Using the internal brace on my Brostrom procedures has been an absolute game changer for my patients, allowing them to walk only 1 to 2 weeks after the procedure and getting back into a regular shoe with an ankle brace shortly thereafter. They tend to experience less pain after surgery as well as more confidence both immediately after surgery and for years to come. They're able to get back to work as well as the activities they want to do quicker. And it also acts as a great revision procedure for patients who had previously had a Brostrom procedure but unfortunately have had return of their ankle instability. This procedure has been wildly successful in my practice, and we've had numerous success stories with athletic patients being able to get back to sports in a relatively quick manner. But the ones that stick out to me are patients such as a recent retiree who loved to hike but unfortunately had experienced chronic ankle instability after an ankle sprain for many years. She was limited in her ability to do what she loved, but after doing a Brostrom procedure with suture tape augmentation, we were able to get her back to doing what she loved in just 3 months. The patient was over the moon about her ability to go back to doing what she loved, and those are the stories that really stick out to me as to why this is such a great procedure. Any patient with ankle instability, no matter how long they've had it, would be a candidate for this procedure, whether they've had a previous Brostrom procedure or not. If someone is experiencing these symptoms, I'd encourage them to make an appointment and come in and see me so that I could evaluate and make sure that this is the correct procedure for you.